All right, so in this video, I'm gonna walk you through a total body lymphatic release technique. I guess you would say just a variety of techniques that you can do to kind of create a whole body lymphatic release with a massage gun. So the massage gun is great for this because they create this tapping motion that can really facilitate the flow of your lymph and just stimulate that system. So what I'm gonna do is just kind of take you through all aspects of it. This will be a little bit of a longer video, but if you can hit all of this, it'll really create a good like total body type of release. So the first thing I'm gonna do is I'm gonna start laying on my back. And pillow, no pillow, up to you. I'm gonna turn the gun on the lowest setting that it has. All right, so if it's going, the faster it goes, the less effective it's going to be. You want it to be on the lowest, one of the lowest levels. Sometimes the knockoff guns can, you may have to turn it up a couple levels, but you want like a nice slower tapping with the gun. All right, now most of our lymph is in our gut, in our head and our neck, so we're gonna start by working there first. All right, so I'm going to take the gun and I'm gonna go onto my stomach. I'm going to start up by the rib cage here, like where the angle of the rib cage is, a little off to the right side. All right, and I'm just gonna walk in a straight line up and down. I'm not on my midline, I'm kind of right off to the right. And I'm just finding the areas that are most tender. So if I'm here and I don't feel anything, I slide down and I'm like, ooh, yeah, I feel that a little bit. I'm just gonna sit there. I'm not pressuring down super hard. I'm just letting the gun kind of tap and do its thing. And I'm just, just slowly working my way down. Typically people will be a little more tender like around the belly button area. So when you get there, you're gonna, spend a little bit more time there. And I'm just gonna nice and slowly just kind of work up and down. After I go spot by spot, I can move it a little bit more. Okay, once I do that, I'm going to do the same thing on the left side. Okay, there's no right or wrong here. You're basically leveraging the tapping motion of the gun to just get things moving. All right, I can come up close to that angle of my ribs. I can work up and down midline a little bit. I'm definitely gonna hook under my belly button and get underneath my belly button here, a little closer to my belt line. And I'm gonna work that until I start to feel like the sensitivity starts to decrease. So there's no right or wrong. You can do this for as short or as long as you want. I think the idea would be that you wanna start feeling like, all right, as I'm doing this, I'm getting less sensitive. And at that point would be when you've kind of done enough to start having an effect. All right, so that's gonna be the first thing that we're going to do. All right, the next thing from there is you're going to dial the gun up 1 or 2 notches so that it's going a little faster. And you're going to put that in the crease of your hip, okay? You can work back and forth a little bit here. You can work out to the side a little bit here. But that crease of the hip is kind of a big junction point where there's a lot of lymph will flow through there. And you want to just hit that spot both sides. All right, spend again, as short or as long as you feel like you want to spend there is totally fine. That'll be your next step. Once you spend your time there, I'm going to dial the gun back down. The next thing I'm going to hit is my sternum or my chest bone. So I'm not going to push in. I'm holding the gun so it's very gently, just superficially tapping on my chest bone. And I'm gonna go up and down the chest bone. Stopping, and if I feel a point of sensitivity, I can stop it there. All right, and again, you're doing that because it's just one of the areas where lymph congregates. It's a big flushing point. All right, same thing as all the other spots. As much or as little time as you want to spend there, you can do it. Next up, I'm gonna put my arm out to the side, and I'm gonna work out through my chest. Okay, and what I wanna do is trace underneath the collarbone. All right, obviously if you're a woman, this would change a little bit where you would feel comfortable doing this, but you want to keep it close to the collarbone. Most of those lymph channels flow close to the collarbone, but the pec is a big area. So I can come out into my pec, I can hug underneath the collarbone. All right, but I'm gonna spend some time there, both sides, with the gun on the low setting. All right, once I have both sides there, the next spot is above the collarbone, and this is one of the biggest ones. So what you're going to do, I'll do it on this side, is you're gonna grab the gun on the side that you're working, something like this, and you're going to just let it kind of sit in that crevice or that little divot that you have between your collarbone and your bigger upper trap muscle. There's this kind of like just divot there. Let the gun sit there. You can move it around a little bit. And that getting that tapping motion going there is a big like it gets things moving in a good way. All right, so you would do that both sides as well. And then from here, we're gonna start working onto the head and the neck. All right, so again, a lot of your lymph is going to be, a lot of your lymph nodes and all that stuff reside in your head and your neck. So we want to like get things moving there as well. All right, so these techniques are a little unconventional and a little weird, like using the gun here. Obviously don't do it if you don't feel comfortable. But if you can, and you do feel comfortable, this can be a great way to just like clear things out, get things moving, and you can get a really good effect from doing this. So the first points you wanna hit are right on this like on the angle of your jaw, okay? Kind of like going back like almost towards your ear. So it's like this general area here. So what I'm going to do is just get the gun there, and I'm not moving it much. I'm not applying pressure in. It's a very gentle, like I'm just holding the gun in the way that is like barely tapping that area. But I'm just small circular motions. If I feel something tender, I'm going to stay there. I would do that both sides. The next thing you're going to do is you're going to trace underneath your jaw. Again, I know it's a little weird, but you have a lot of lymph that sits here. Getting that tapping motion going through here is a great way to get it to start moving. So you're gonna flip the gun up. You're gonna have to find your hand grip, but you're gonna flip it like this. You're gonna lift your jaw up. And I'm just going to trace underneath the jaw. I think it's a lot easier sometimes to just hold the gun still and move your head. You can't do it. Again, no right or wrong here. You're just trying to hit the spots. Okay, if I find something that is a little uncomfortable, I may stay there for a little while, and I'm just gonna do that again, same ways with everything else, until I start feeling like the sensitivity starts to back off. Okay. Next up from there, I'm going to take the gun. I'm going to hit my temples. Okay, now again, I'm not pushing in. If you do it wrong, the gun will start, or if you angle it wrong, it'll start kind of jumping on you, and it's not gonna feel very comfortable. So I'm using this flat head attachment. I'm getting the gun just so it's gently tapping on that area. All right, and I'm holding there. This one I'm not gonna hold too long, but I'm gonna let the gun do its tapping thing, and it's just gonna get things moving. All right, I'm also going to hit this point between my eye and my nose. So if I draw a line down from my eye and a line out from my nose, there's this spot kind of right here in the middle of your cheek. It's another point where things congregate, and I'm doing the same thing. I'll close my eyes, just get that gun there nice and soft. Let it do its thing for a couple seconds, and then I'll go to the other side. Now, once you've hit all of those points, like you've gotten a pretty good gut, head, neck release, but we're gonna flip up now off of our back, and we're gonna just get our lower body down. Okay, so what we're gonna do is we're gonna do this on both sides, but you want to orient yourself in this position where one leg is in front, the other one's kind of bent back behind. You're gonna dial the gun up a little bit for the rest of this, so you're not on the lowest setting, maybe like one up from the lowest setting. And there's not necessarily like an order to do this in, but I'm just gonna walk you through the spots that you're gonna wanna hit. All right, so the first spot you're gonna wanna hit is gonna be up and down. You're gonna trace along the line of your shin, okay? So I can start close to my ankle. I can work my way up. This spot kind of right in here, around the knee, is another big sensitivity spot. Like you may find that you're tender there, but you're just gonna walk up and down. I'm not on the bone. I'm kind of like right off the bone. All right, if I find a tender spot, I may stay on it for a few minutes. I may work back into my calf a little bit around that sensitivity spot. I may flip the gun, point my toes down and get into my Achilles. That can feel good as well here. All right, but I'm just generally working that area. Now from there, I'm going to come up and I'm going to get my inner thigh. Now the inner thigh can be sensitive. You may have to dial the gun back when you first get started with this. It's just, again, one of those just channels where a lot of the stuff flows and it has a tendency to get sensitive. But you're going to just work up and down, starting at the knee. I'm just right on the inside of my thigh. And again, I find a sensitive spot, I may stay on it. That sensitive spot may be closer to my knee, it may be closer to my groin. I can get up into my groin here, I can hit the front of my hip from here. All right, and I'm just working that line. All right, the biggest mistakes, you don't want to be doing this and like going really fast. It's slow, circular motions. Stay on one spot, let the tapping do its thing, and don't go overly fast, okay? From there, I'm gonna dial the gun back up. The last thing we're gonna do here is the back leg. All right, so from here, this is a really good angle to get into the hip, like the outer hip, get into the front of the hip, which again, that crease of the hip area is a big congregation point for a lot of your lymph. So I'm gonna spend a little bit of time there. All right, and the other spots you wanna get here, the biggest one is actually behind your knee. So this is like one of the best, like for me, at least personally, like is one of the best feeling areas of the whole thing. It's like a weird spot, but again, it's just one of those areas where things congregate and get stuck. So if you get that gun in the back of that knee, just let it stay relaxed. Small circular motions. You can go into your calf, up into your leg a little bit, but you just work that back of your knee for a minute or two, and you'll start to feel the release effect. The last thing you can do is if you just get up and down that line of your calf, you can get into your Achilles from there, and it'll feel really good. If you do that sequence of things, starting on your back, coming up into this position, from here we would just switch sides and do the same sequence, both sides. If you can go through that whole sequence, you'll create a nice kind of full body inflammatory reset and should get a good effect from that.